When mobilizing a patient out of bed, such as transferring or ambulating the patient, the gait belt is an invaluable tool that can improve both provider and patient safety. But before you use a gait belt, you first need to know how to apply it. Whenever you apply a gait belt to a patient, follow these steps to ensure proper placement. Let's begin by looking at the clasp on the belt. When applying the belt, the clasp will always be on the outside, facing away from the patient. To use the clasp, lift it up. This will create an opening to insert the end of the belt. If the clasp is not lifted, the end of the belt cannot be fed through. Lift the clasp and feed the end through the opening. Hold the clasp open while you continue to feed the belt through to the desired tightness. Once you achieve that tightness, press the clasp down firmly to ensure that it locks. Do not just release the clasp. It may feel like it will hold the belt in place, but it is not locked in place unless you firmly press down on the clasp. When applying the belt to a patient, ideally, the gait belt should be positioned around the patient's waist. That's below the ribs or breasts and above the pelvic bone. But be mindful of any restrictions the patient may have, such as fractures, tubes, lines, etc., where you may need to alter the placement of the gait belt. Lift up on the clasp as you insert the end of the gait belt. Feed the belt through the clasp until you reach the desired tightness, which is 2 fingers between the belt and the patient, and firmly press down on the clasp to lock it into place. You want the belt to be snug, so it does not rise up on the patient during use.